So let me just take a few minutes and go over how to easily answer every one of your patient's clinical questions. Every one, because remember, patients can ask thousands and thousands of different types of questions. We know it's not that way. It's the 80-20 rule. But in other words, we can't give you an answer for every potential question a patient can ask, but we can give you the template. So I'm going to give you the template. This is the template of how to answer every patient's clinical question. Now, this applies to my doctors that I do consulting with in patient education, because we teach, our patient education is based on the science of the 3 phases of healing and the patient's biomarkers. So that's what this is based on. So if you're not doing patient education based on that, then this won't apply to you. But this is how you answer every question. So it doesn't matter, because a client asked me, he goes, the example I'll give, I had a client say, well, how do you answer a question when you're covering a topic and the patient says, well, is that serious? Well, that happens every now and then. You'll be going over information and the patient will say, is that serious? Well, whatever the clinical question is, you just have to go to the core of why. Why are you doing what you're doing? So this is the answer to every clinical question. So this is what you need to remember. So what determines, I'll go through the long cycle and then I'll come back and paraphrase it. So let's say the patient asks a clinical question. So, well, what determines how you respond to care, or how much better you get, worse, how much you get better, worse, or stay the same, or even end up with a permanent injury? It depends on 2 factors. One is your test, your positive test, and one is the 3 phases of healing. So your positive, now I personalize it. Your tests were XYZ, whatever their positive tests were, and your ADLs, your main ADL was this. This is where you had pain restrictions. So your body heals in 3 phases. There's the inflammation, repair, and remodel phase. So we apply the appropriate therapy in each phase, and then we recheck the test at each re-exam, which is about every 12 visits. And that's what determines, and that's how we know whether you're getting better, worse, the same, staying the same, or potentially even end up with a permanent injury to some degree. That's how we know. It's those tests at every re-exam. That's the answer to every clinical question you get. Remember those principles. Remember those concepts right there. Those are like major bullet points. Because that is exactly what determines, that's how you determine the diagnosis. That's how you determine if the patient's getting better, worse, staying the same, or has a permanent injury. It's their test relative to the science of the 3 phases of healing. And so we just simplify it. And then I personalized it right there when I said your tests were this, this, and that. And your ADL was this. So your body heals in 3 phases. We have used the appropriate therapy for each of the 3 phases to try to get you back to normal as fast as possible. But it's the test, when we recheck your test at each re-exam, that's what's going to tell us whether you're getting better, worse, staying the same, or eventually may end up with a permanent injury. That's how we know how you're going to respond to care and heal. It's all back to third party. It's all back to third party trust factors. And it's all back to what you educated them on. It's back to supporting what you're doing. This is exactly the answer. There's no reason to be confused. And I know what that's like when I got out of school, and there wasn't a foundation per se. And, patients would ask a clinical question, and sometimes, you're scrambling in your mind, well, what's the answer to that? Well, this is always the answer for every clinical question.